Hello everyone, I'm Zixu and I'm gonna introduce you a latest cloud-based data platform which is designed specifically to healthcare industry, the Intersystems IRIS for health. I found this product in a news that this technology was just applied in Mediway technology, new iMedical Cloud Healthcare IT ecosystem platform, which fastened the informatization of healthcare in China, my hometown. It triggered my interest to a large extent. As a result, I did some research on this product. Here is the content, and here is my searching strategy. Firstly, I found the topic which I am interested in. Then I searched the real-time background of the product, including the prototype of the product, the technology which support the product, and its current practical use. The main source of this part are the article published by the company which provide the product and some public news. After the research in industry sources, I put more efforts on the scholarly sources, focusing on how the IT technology helped the product or the service. The source of the scholarly information are mainly from the reports and the papers published by the partners of the company, which offered technology to support the product, and some researchers from the third party. All this scholarly source may contain the assessment of the current state and the expectation of the product in the future. In this case, the technical supporter of the product is the same as the product provider. The Intersystems IRIS for health has three key functions. First one, it provides an extensible, fast healthcare interoperability resource repository, file repository, which could offer plenty of clean and valuable healthcare information for the modern healthcare application developers. The access of this information could be real-time. The second function is that this platform provides a normalized healthcare message model to transfer all standard, modern, and legacy data representations. The different standards between multiple healthcare information systems won't be the restriction of data researching and sharing anymore. The last function is that it could deep support for all interoperability standards and protocols, which ensured interoperability and improve the workflow across the care continuum. Based on the CCP evaluation framework, I conclude some pros and cons of the Intersystems IRIS for health from context, content, and the process dimensions. Here is the pros, and firstly, the actual pros. It ensured interoperability, scalability, and reliability of data. Secondly, it accelerated the connectivity across data sources as the platform simplified the information sharing processes to a larger extent. There are also some potential pros. Healthcare innovation is the biggest one. The extensible file repository will be the largest information source for all healthcare application developers all around the world. This platform provides any resources they need for the researchers like machine learning or simulation, and will benefit the decision making as well. Here are also some cons of the product. Firstly, the actual cons is the training cost. The training cost is an inescapable issue that all clinics or organizations which have the intention to use the new data platform. The training time and the training cost will absolutely postpone the product to reach its desired achievement. Data breach is another drawback of this product, as all information on the platform are currently stored on cloud server. The patient's personal data are taking the high risk of breaching. There are also some potential cons. The further update could be a problem for the Intersystems company. After the clients familiar with the system in the future, they will present multiple customization requirements to the company. How to deal with the numerous specific requirements, the company have to make a clear roadmap for the whole project. Based on the costs, I come up with some recommendations. First of all, Intersystems company should provide a thorough and professional training plan for different tiers of organizations. With the guidance of the company, the specific training methods would more efficient. Secondly, set different authority levels to prevent data breach. Different users of platforms should have different authority levels to determine how much information they could access and what kind of operation they can do on those data. It could protect the data from the breaching to a larger extent. To the update issues, the company could provide different versions of applications which offer different modules and functions. The users could select which version to use to avoid redundant modification or customization. Or, on the other hand, the company could coordinate with third-party agency to outsource the customization duties. Here is my reference, and thank you for your listening.